Hi, I'm Kelly Davis, and I just want to introduce myself and tell you that I'm so excited to see you here in my aesthetic suite. But I just wanted to go over a couple things, that way we could kind of knock out the consult, or at least part of the consult, before you get here. So as you know, or you may not know, that I specialize in artistry, so aesthetic artistry. And what that means to me is I like to do artwork. And so whenever my patients come in, I like to know exactly what bothers them when they look in the mirror. And then I can just put together a treatment plan that is specific for you and what bothers you, and then also what I see as an aesthetic artist. So I can do everything from injections, which is going to be your neurotoxin. I'm sure you've heard of Botox, Dysport. I really focus with the Jeuveau and the Daxxify, and then of course fillers. I also do lasers, cool sculpting, sexual wellness procedures, and other skincare treatments. One of the latest things that I've been doing is some exosome treatments, where instead of doing PRP or PRF injections underneath the eyes to help stimulate and build collagen, I'm using exosomes. So what I like to do is a little derma stamping, where I'm just kind of breaking open the skin, and I'll put the exosomes all over the area if I'm doing full face. And then if I'm just doing eyes, I'll put the exosomes all the way up underneath there. And then I'll actually take part of the exosomes and do tiny little injections. And that actually will help stimulate and build collagen and elastin in a very natural way. I don't like to do fillers underneath the eyes because I feel like with that hyaluronic acid, 7 out of 10 patients over the years, some of that hyaluronic acid will actually come back and migrate through, and you'll see little bumps in your duct area. So that's just something I don't want to do. But in order to have your eyes look nice and just kind of build that skin, because this is a thinner area, the exosome treatment has been amazing. So that's something I have been doing. I actually kind of created the treatment myself, and it's been going amazing. I just love the results on it. So that is something that we can take care of for anybody who has under eyes that have crepiness, dark circles, or even the fine lines and wrinkles, especially because we can't do a whole lot of neurotoxin under there all the time, just depending on your age. So the exosome treatment is definitely something that I would recommend for that. As far as neurotoxins, I like to do all kinds of areas for that. Everybody usually comes in and they're used to doing the areas up in this area. So of course your forehead, of course your glabella, but the couple things that I do that is a little different is I like to do what I call a neurotoxin eye bluff, and I'll do 1 unit here and 1 unit here. And basically what that does is it helps open up the eyes and helps take off some heavy eyelids. I know that that's something that most injectors don't do. However, if it's done correctly, it works amazing. I've done quite a few of those, and as long as the aftercare is done properly and the injection's done properly, it works great. Basically, this muscle is a round, flat muscle. It's called the orbicularis oris, and it basically opens up like this, right? And so when you do a little bit of neurotoxin right there in that area, again, very superficially, just in the right spot, it actually helps that eye open. Now, I know some of you have actually probably heard of a heavy eyelid, or maybe you've experienced that yourself. So I really like to educate on that. Anytime we're doing neurotoxins around the eye, so that's when we're doing for the glabella, which is the 11s, we actually inject right above the eyebrow area. And then also even just injecting around for the crow's feet, or even just when you're injecting in the forehead, which is your frontalis. What happens is whenever we're doing the injections, we place the injections right in the part of the muscle that we need the neurotoxin to stay. We have this one muscle that's right here in the middle of your eye. It's called the levator muscle, and it makes your eye go up and down, up and down. So anybody that has experienced a heavy eyelid or a droopy eyelid after a neurotoxin, it is because some of the neurotoxin from one of those areas, whether it be the forehead or anywhere around the eye, has actually diffused into that levator muscle. So if you've had that experience, typically you know it'll kick in within about a week, and it usually lasts 2 to 3 weeks. It doesn't typically last the whole 3 months, because most injectors are not going to be injecting straight into that muscle. I really like to talk about that and teach and educate. That is why it's so important that you want to make sure that you stay upright for 4 hours after your injection service. You also want to make sure that you don't sweat for 24 hours because, one, you don't want your body to detoxify and push the neurotoxin out, or you don't want any of that neurotoxin to diffuse into any of the muscles that we don't want that neurotoxin to go into. The other thing is we also tell you not to do any facial activity or even massage for 2 weeks, because even on a massage, when you go face down, or if you sleep on your face, that could actually cause the neurotoxin to spread into a muscle and diffuse into a muscle that we don't want it to. You can always, wash your face normal, but anytime we're doing anything around the forehead or around the eyes, you always want to wash up and out, up and out, up and out. So we want your eyes to be open and out. So I do obviously the normal areas, so around the eyes, the forehead, the glabella, and then I can sometimes do a little bit underneath here, just depending on your skin integrity for the crepiness. So those are the things that I do. I absolutely love being creative with neurotoxins. Some of the other things that I can do with neurotoxins, so again, that's your Botox, your Dysport, Jeuveau and Daxxify, is you can do what we call the DAO. So that's these two little muscles right here. Over time, they're pulling your smile lines, they're pulling it down. So you can do a little bit of injections here, and it just very naturally just pushes this muscle back up. The other thing that you can do, you've probably heard of doing a lip flip. So you can do top lip or bottom lip, and that just causes your lips to kind of puff out a little bit. It's great for somebody who has lip filler and it's just kind of an in-between. It's great for somebody who isn't quite ready to do lip filler, but they want to see what their lips look like a little bit more full. Now, I like to always tell people the first time that you do it, and if you don't continue it every 3 to 4 months, when it kicks in, there's definitely a time that you could have a little bit of drooling effect or a lisp. It can cause kind of a lisp in your talk. So I definitely like to let people know, just plan on that ahead of time. It's something that, again, will kick in about a week, and it could last up to 2 to 3 weeks. Nobody warned me on that the very first time I got that around my lips. And I was actually at a dinner, and all of a sudden I was eating and my food was like falling out. So I definitely like to educate my patients on that. So if you're planning to do a lip flip for the very first time, we don't want to plan it around a time that you're going to be in a big event, or definitely around a time that you're going to be up on stage speaking or something like that. So again, it doesn't happen to everybody, but it can happen. So I always like to make sure my patients are aware of those things ahead of time. So again, we can do the DAO, we can do the lip flip. The other thing I love to do is the chin tox. If you go and pout your bottom lip out, and whenever you go to pout it out, if you have some dimpling right there, it is really nice to do a little bit of neurotoxin right there, because it helps smooth out that dimpling, but it also gives you a nice, aesthetically more pleasing chin line. Also, if you have what we call a gummy smile, so you go to smile and you can see your gums, you can do a little bit of neurotoxin right through here, up through here, and that actually will just make that smile not go up as much. I can also use a little bit of neurotoxin right in this area to help soften the nasolabial folds, because again, when you go to smile, it's these lines right here that give a crease. I also like to tell people on that, when that can happen, you can actually think your smile looks a little weird, because again, your smile goes up, and then if you do a little bit of a neurotoxin right through there, it's causing those muscles to push back down. And so sometimes when you go to smile, you may feel like your smile looks a little bit flat. Neurotoxin lasts about 3 to 4 months, so it's always okay to try something out and just see if you like it. And if you don't like it, we just don't re-inject there. But those are some cool things that we can do. I can also do a little bit of neurotoxin on the nose area to make your nostrils look a little bit smaller, for those of you who feel like you have larger nostrils. And then we can do masseters. So the masseters are the big muscle right here on your jawline. I like to do that for aesthetic purposes. For somebody who has a really square looking jawline, it'll just soften those muscles and just give your jaw a little bit nicer drop to give you a more aesthetically pleasing jawline. It's also good for people who have TMJ or who do a lot of clenching or anything like that. We can do the masseters for that. And also, I like to make sure to let our patients know that masseters do not need to be done every single toxin service. Like the rest of the areas can pretty much be done every service. You don't want to weaken these muscles to where over time as you age, we always have muscle atrophy, which means your muscles deteriorate. And then obviously we know gravity drops everything down, right? And so when we're doing masseters, we want to do maybe 2 or 3 sessions if we're doing it for TMJ. And then as long as you're not having clenching or biting anymore, then we want to hold off for, until you have that come back in. As for aesthetic purposes, you can do it 2 or 3 times, and then I'm gonna recommend maybe every other time after that, because again, we don't want to wear those muscles down so much to where as you age, the time comes that those muscles will just drop, and then because of muscle atrophy, not be able to function. So I do like to educate everybody on that as well. Platysmal bands are one of my favorite things to do. So basically we have a muscle that goes from right here all the way down our neck. And I know as women, even men, but mostly women, we are always worrying about our face with our skincare, and you can typically see our age on our neck, our chest, and our hands. And so doing the platysma bands makes such a difference on just kind of pulling all this together. So basically we know that what happens over time is we've got bone loss, muscle, and fat loss. And so that's why our face and everything starts going down. We start getting the nasolabial folds, and then we get these things called the jowls. And that's kind of the little areas, the little bumps right up underneath here. So the jowls a lot of times can be corrected with some fillers, but doing the platysmal bands helps out a lot as well. So with the platysmal bands, you actually can do some injections right here and then just go all the way down the neck. And what that does is that forces that muscle to go whoop, and it pushes back up and gives you a neck lift. Plus the way that I inject, I go across the whole neckline, and that actually helps smooth out the skin, because I like to use the Daxxify for that. The Daxxify actually has peptides in it, so it helps with skin tightening as well. So I definitely like to recommend doing the neck lift for anybody who has jowls or any kind of crepey skin. I also love doing fillers. Fillers are so amazing. We can do them for many different purposes, and we can do them for, if you look at some of my before and after pictures, I've actually done really round faces. We can do some on our chin, some on our jawline, and that just helps elongate and give a more natural look, more aesthetically pleasing jawline. I do a lot of cheek and chin fillers, and it will just help pull the chin out, lift up, and just that will help with some of the neckline as well. And then I also like to do different things to help with just the little fine lines around this area. We can do some finesse and just fill in without making you look plump and marshmallowy. Anytime I'm thinking about skincare, I'm also going to include different skin treatments. So we can talk about doing lasers and Fraxel for skin tightening, photofacials to help with pigment removal, spider vein removal. Then of course, cool sculpting, that's gonna help reduce the fat throughout your body. We have sexual wellness procedures. So if you have incontinence, we also have the ImFem. So that is gonna be a vaginal rejuvenation radiofrequency treatment for females. And that is where we are going to be able to tighten the inside of your vagina, and we're going to be able to tighten the labia area also. I've actually created the Fraxel facelift, Fraxel neck lift. And what I do is I do Fraxel. The way that I do that treatment, plus adding in the exosomes, we can actually get a really nice lift on your face and on your neck. And most recently, I created the Fraxel labia lift. So that is actually tightening and lightening the labia area as well. So there's different things that we can do just to make you look your best. And of course, we can do different exfoliating treatments such as dermaplaning. We are doing teeth whitening here as well. I look forward to meeting each and every one of you, and I'm ready to see you here at my aesthetic suite.